Hi everyone, I'm Aleysia. I'm a certified nursing assistant, also known as a CNA. And CNAs like myself are integral members amongst healthcare as we support nursing staff in caring for our patients. I've been a CNA for 3 years, and if you've been considering a career as a CNA, in this video, I'll be sharing with you everything you need to know about being a CNA, including role responsibilities and requirements you need to become one. I'll even give you insight on where you could work as a CNA and how much money you can make as a CNA as well. Now, if you're interested in working in healthcare or even becoming a nurse, a role as a CNA can be a great place to start. So I'm sure you're wondering, what does a CNA even do? Let me give you some facts. So what does a CNA do? A CNA's role is to assist nurses with activities of daily living, or ADLs, within patient care. Other names for CNA could be nursing assistant, certified nursing assistant, patient care assistant, PCA, patient care technician, PCT, or even nurse's aide. There is a variety of different names for the role, but regardless of the name, all the roles perform the same tasks for patients. My CNA experience started at an acute rehab hospital where I work now. I started off as a full-time CNA on the TBI brain injury unit where I fell in love with healthcare. Later, after working alongside nurses and in healthcare, I decided to go to nursing school. I was able to drop my full-time hours down to per diem, and being per diem allowed me to still be a CNA and get patient care experience while going to nursing school at the same time. Now, what is the difference between a medical assistant and a CNA? Medical assistants get to enjoy the best of both worlds as they have more of a variety of where they can work based on the facilities. They also are able to tackle both direct patient care and also doing administrative work. CNAs, on the other hand, work directly with patients at all times, and both roles are very similar, just have overall different tasks. If you're looking for more tips, company reviews, or new job opportunities, you can create an Indeed account and customize your job feed to get started. So now that we know what a CNA does, let's discuss the requirements to become one. So in order to obtain a CNA license, you would have to complete a CNA program. CNA programs or trainings can take up to a month or 8 weeks, depending on your state and your program. After completion of your program, CNAs do have to take a state board license exam as well as a live skill test in order to obtain your license. You do get a CNA certificate once you graduate from your program, but when you pass your state exam, that is when you receive your CNA license. Without that active CNA license, which needs to be renewed every 2 years, you cannot work as a CNA regardless of the certificate from your program. You might have the question on where to get certified. Many different facilities, hospitals, even healthcare companies also hold programs so that you can have an opportunity to work for their company or hospital or facility as well. So let's now talk about some CNA skills. CNA skills include bathing, dressing, feeding, obtaining vital signs for patients, bathroom assistance, or all activities of daily living, or ADLs, for patients. It's very important that CNAs only perform tasks within their scope of practice. If tasks are done outside of a CNA scope of practice, or if a CNA does a task beyond what their scope or license permits them to do, you can be at risk of losing your license. So it's important to follow your state's protocols for your license. Different states allow CNAs to do different things within your scope of practice, so it all depends. For advice on how to incorporate these skills in your resume, be sure to check this video right here. Now that we know how to become a CNA, let's talk about where CNA can work. CNAs can work at hospitals, at the home, long-term care facilities, a nursing home, assisted living, and the list goes on. Most common shifts for CNA are 7 to 3, 3 to 11, or 11 to 7. A common question that I get asked often is, how much money can a CNA make? According to Indeed data, the average base salary for a CNA is $16.88 per hour. You'll make up to $30 or even more per hour due to the high demand as a result of the COVID-19 pandemic. If you found this helpful, please hit the like button down below and subscribe to our channel. For more tips, I recommend checking our playlist here. I hope you found this information helpful and will use it in the future for your upcoming job prep. Thank you so much for watching, and we'll see you next time. Bye.